Today, let's talk about something that could save a life: silent heart attacks. Unlike the dramatic heart attacks we see in movies, silent heart attacks don't always come with crushing chest pain. Instead, they creep in quietly, often mistaken for something as mild as indigestion, fatigue, or discomfort that comes and goes. You might be surprised to learn that nearly 45% of all heart attacks are silent, meaning the person doesn't even realize it's happening. Many only find out later during a routine checkup or, unfortunately, after experiencing heart failure. That's why recognizing the warning signs is so important. Unlike the usual signs of a heart attack, severe chest pain and breathlessness, silent heart attacks can show up differently. Some common symptoms include mild pressure in the chest, a feeling of indigestion or fullness, unexplained fatigue or dizziness, shortness of breath even when resting, discomfort in the jaw, upper back or left arm, and cold sweats or nausea. Many people brush these off, assuming they're just tired or dealing with something minor. But ignoring them could be a mistake. These subtle symptoms might be the only warning before a more serious event occurs. Certain groups are at a higher risk for experiencing a silent heart attack, often without realizing it. Research shows that men over 45 and women over 55 are more likely to experience silent heart attacks. People with diabetes are at increased risk since nerve damage can prevent them from feeling pain. High blood pressure and high cholesterol raise the chances of heart disease, and smoking and obesity increase the risk of silent and traditional heart attacks. Women, especially those over 60, are more likely to have silent heart attacks than men, and they're also more likely to be misdiagnosed. Many believe that heart attacks always come with intense pain, but the reality is different. Some people only experience minor discomfort or don't feel much at all, which is why it often goes undetected. The best way to prevent a silent heart attack is to listen to your body and not ignore symptoms that feel off. Regular checkups are crucial, especially for those at higher risk. Routine ECGs and blood tests can sometimes detect early signs of heart disease before a major event occurs. Managing risk factors like blood pressure, cholesterol, and diabetes is also key to reducing the chances of a heart attack. A heart-healthy lifestyle is one of the best ways to protect yourself. Eating a balanced diet, staying active, and managing stress can significantly lower your risk. And if you ever feel sudden fatigue, dizziness, or discomfort that doesn't feel right, don't wait. Seek medical attention as soon as possible. If a silent heart attack is detected, doctors may recommend medications like blood thinners, beta blockers, or statins to prevent future attacks. In some cases, stents or bypass surgery may be needed to open blocked arteries. The earlier it's detected, the better the chances of avoiding life-threatening complications. Thank you for watching. If this information was helpful, make sure to follow for more health-related insights.
Hey there! Have you ever felt dizzy or lightheaded? Maybe you stood up too fast and everything went black for a second, or you suddenly felt like the world was spinning around you. It happens to all of us, and most of the time we just shake it off. But what if that dizziness is actually a warning sign of something serious? Not all dizziness is the same, and understanding the difference can save your life. Lightheadedness, that feeling like you might faint, is often caused by low blood pressure, dehydration, or anemia. If you've skipped meals, aren't drinking enough water, or feel weak, your brain isn't getting enough oxygen-rich blood. Then there's vertigo, the sensation that the room is spinning around you, which is usually caused by inner ear problems, infections, or even neurological conditions. Some people experience disequilibrium, a feeling of imbalance, which can be linked to nerve issues, stroke, or brain disorders. But here's where it gets scary. If dizziness comes on suddenly and intensely, or happens with blurred vision, slurred speech, confusion, or weakness on one side of the body, it could be a stroke or a heart problem, and that's an emergency. Dizziness with chest pain, shortness of breath, or an irregular heartbeat might signal a heart attack or arrhythmia. And if your dizziness lasts for days, keeps coming back, or is getting worse, it could mean something deeper, like neurological disorders, chronic low blood pressure, or even anemia due to undiagnosed internal bleeding. So when should you worry? If your dizziness is severe, happens frequently, or comes with fainting, confusion, or numbness, don't ignore it, get checked. A simple test could catch a heart problem, inner ear disorder, or even a neurological issue before it becomes life-threatening. If this got you thinking and you want to know more about real-life cases where dizziness was a red flag, check out our animated medical series, where we bring these stories to life.
Hello, everyone. Hope you're doing well. Today, let's talk about something we've all experienced at some point: indigestion. A heavy meal, a bit of stress, maybe eating too fast, and suddenly there's that familiar discomfort in the chest or stomach. It's easy to brush it off, take an antacid, and move on. But what if that simple indigestion is actually a warning sign of something far more serious? Many dangerous conditions can disguise themselves as mild digestive discomfort. One of the most concerning is a silent heart attack. Heart-related pain doesn't always feel like crushing chest pressure. Sometimes it presents as burning, fullness, or discomfort in the upper abdomen, almost identical to acid reflux or bloating. This is why many people ignore the early warning signs, assuming it's just something they ate. In reality, mistaking a heart attack for indigestion can be life-threatening. Another condition that can mimic indigestion is gallbladder disease. If you experience recurring discomfort after fatty meals, bloating, or nausea, it could be due to gallstones blocking the bile ducts. Left untreated, this can lead to infection or even rupture, requiring emergency surgery. Similarly, stomach ulcers can also cause burning pain, nausea, and discomfort, often mistaken for simple acid reflux. But in severe cases, they can lead to internal bleeding or perforation, which can become a medical emergency. A more unexpected cause of persistent indigestion-like symptoms is pancreatic cancer. While rare, early symptoms can be vague, just mild bloating, discomfort, or changes in digestion. By the time it's recognized, it's often in later stages. Persistent or unexplained indigestion that doesn't go away with typical treatments should always be checked, especially if accompanied by unintended weight loss, jaundice, or fatigue. There are also other conditions that can start with mild digestive discomfort, but signal something more. Gastroesophageal reflux disease, GERD. If indigestion is frequent, it could be GERD, which can lead to complications like esophageal ulcers, strictures, or even Barrett's esophagus, a condition that increases the risk of esophageal cancer. Hiatal hernia. A portion of the stomach pushing through the diaphragm can cause reflux, chest discomfort, and difficulty swallowing. Irritable bowel syndrome, IBS, bloating, abdominal pain, and irregular bowel movements are often mistaken for simple indigestion. Gastroparesis, a condition where the stomach empties too slowly, leading to persistent bloating, nausea, and discomfort, often seen in people with diabetes. Food intolerances. Sometimes, persistent indigestion is actually a sign of lactose intolerance, gluten sensitivity, or other food-related issues that cause chronic inflammation in the gut. So, how can you tell when indigestion is just harmless acid reflux and when it's something more? If symptoms are new, persistent, or worsening despite antacids, if you experience chest discomfort that radiates to the arm, jaw, or back, or if indigestion comes with sweating, dizziness, or shortness of breath, don't ignore it. Get it checked. If something doesn't feel right, it's always better to be safe than sorry.
Hello there, I'm Dr. James Parker, and today we're talking about something that many of us have experienced at some point: unexplained fevers and rashes. Have you ever had a fever that just wouldn't go away, or a rash that appeared out of nowhere? Most of the time these symptoms are harmless and linked to common infections, but sometimes they could be a sign of something more serious. In the next couple of minutes, I'll help you understand what hidden illnesses might be behind persistent fevers and unusual rashes, and when you should consider seeing a doctor. Let's get started. Fever is your body's natural way of fighting infections, kind of like an internal alarm system. But when a fever lasts more than a few days, keeps coming back, or doesn't have an obvious cause, it can be a warning sign. The same goes for rashes. A simple allergy or viral infection can cause a temporary rash, but if a rash spreads rapidly, turns purplish, or is accompanied by high fever, fatigue, or other unexplained symptoms, it's time to take it seriously. Some of the more serious conditions that can cause unexplained fevers and rashes include bacterial and viral infections like tuberculosis, which often presents with prolonged fevers, night sweats, and weight loss. Another rare but important condition to be aware of is adult-onset Still's disease, an autoimmune disorder that causes high fevers, joint pain, and a salmon pink rash that comes and goes. In some cases, unexplained fevers can be an early sign of cancers like leukemia and lymphoma, where persistent fever, fatigue, swollen lymph nodes, and skin changes are common warning signs. If a fever is accompanied by extreme tiredness, night sweats, or unintentional weight loss, these conditions should be ruled out as soon as possible. So how do you know when a fever or rash is something to worry about? Here are some red flags. A fever lasting more than 5 days, a rash that spreads quickly or doesn't fade when pressed, severe headaches or confusion, night sweats, unexplained weight loss, swollen lymph nodes, difficulty breathing, or persistent joint and muscle pain. If any of these symptoms sound familiar, don't wait. Seek medical attention immediately. Of course, not every fever or rash is a cause for panic. Most cases are mild and resolve on their own, but it's always best to listen to your body. Stay hydrated, monitor your symptoms, and if things aren't improving, don't hesitate to see a doctor. Early detection and treatment can make all the difference in conditions like tuberculosis, autoimmune diseases, and even early-stage cancers. I hope this video helped you understand why unexplained fevers and rashes should never be ignored. If you found this information useful, don't forget to like, share, and subscribe for more health insights. Let's stay informed, stay safe, and take care of